The finger stick protocol is the second procedure during a checkpoint visit, which takes place in our GoKids assessment room immediately after the participant completes their venous blood sample at University Health Services. The finger stick protocol allows us to test the participant's blood glucose and hemoglobin A1C. All of the necessary equipment for both the blood glucose and hemoglobin A1C is located in the assessment room in GoKids. It is recommended that all of the materials be ready before the participant arrives. After each of the procedures, enter the participant's results directly into the REDCap system. The materials needed for a finger stick are disposable non-latex gloves, single-use safety lancet, 70% isopropyl alcohol swabs, gauze pads, Band-Aids, alcohol-based hand sanitizer, cleansing wipes, Blue Chucks disposable underpad, Sharps container, One Touch Ultra 2 test strip, One Touch Ultra 2 monitor, HbA1c monitor, HbA1c kit number 1, HbA1c kit number 2, and a biohazard bag. In preparing for the finger stick protocol, remember to check the expiration dates on the One Touch Ultra test strips, HbA1c kit number 1 and HbA1c kit number 2. Document lot numbers on One Touch Ultra test strips and HbA1c kits. Place the Blue Chucks underpad on surfaces that will be used. Insert a One Touch Ultra 2 test strip into the meter to turn the meter on. The 3 contact bars should face you. Make sure blood meter reads Apply Blood. Open HbA1c packet number 1, the purple packet, the sample dilution kit. Remove A1C shaker from pouch number 1 and lay aside. Do not open HbA1c packet number 2, the red packet that reads test cartridge, until you are ready to use it. This must be done after the blood has been collected and used within 2 minutes of opening. Cleanse hands thoroughly using antiseptic soap or alcohol-based hand sanitizer. Dry hands thoroughly and apply non-latex gloves. Now we'll do the finger stick. You can expect a sharp pinch. We'll only collect a few drops of blood. When we've collected the blood sample, we'll apply a little bit of pressure to stop the bleeding. When the bleeding is stopped, we'll put a Band-Aid on your finger. Which hand would you prefer to use?
My right hand.
Okay, you can place that up here. Thank you. Okay, now we'll do the finger stick. I can do the stick on either this finger or this finger. Which would you prefer?
This one.
Okay. First, I'll clean it with a little bit of alcohol. It might be a little bit cold. Let that dry for a second. Okay. Ready?
Mm-hmm.
Okay, and you can just leave your hand there. I'll wipe the first drop of blood away. And I'll collect the first sample. Now I just might have to squeeze a little bit for the second sample. Right, and just hold your hand still. See a little more blood for this one. Okay, and you can apply pressure to that. All right, has that stopped bleeding?
Yep.
Great. You can put the Band-Aid on. Examine fingers to ensure no calluses or injuries and inform participant if other finger is a better choice. Choose a spot on the pinky side of the center fingers of either hand. Fingers and hands should be warm to the touch. If hands are cool, either wash the participant's hands with warm water, gently massage the finger from the base to the tip several times to bring the blood to the fingertips, or use a heating pad to warm the participant's hand. Clean the site with a 70% isopropyl alcohol swab. Allow the site to dry thoroughly before pricking the finger. With participant's finger fully extended, hold finger at last joint, causing the tip to become plump or full, and firmly prick the selected site with a lancet. Place the lancet immediately into the sharps container. Make sure to apply pressure with the lancet prior to pressing the button and activating the lancet. Gently squeeze the finger below the prick site to attain a drop of blood. Wipe away this first drop of blood with a square of gauze. Gently squeeze the finger again, holding it downward until a second large drop of blood forms. Do not milk the finger. The puncture should provide a free-flowing drop of blood. For blood glucose testing, you will need the OneTouch Ultra 2 test strips and the OneTouch Ultra 2 monitor. After completing the finger stick instructions mentioned previously, keep the participant's finger extended and steady. Apply the second drop of blood to the test strip. If blood smears or runs, wipe away and allow for a new drop of blood to form. Do not milk the finger. If no new drop forms, prep a new site on a different finger for the stick. Line up test strip perpendicular with blood samples so that narrow yellow channel on the edge of the test strip is almost touching the edge of the blood droplet. Gently touch the yellow channel to the edge of the sample. Wait and watch for confirmation window to fill completely. Do not push the test strip against the fingertip. The strip may not fill completely. Do not smear or scrape the drop of blood with the strip. Do not apply additional blood after removing the strip from the original sample. Do not move strip in the meter while collecting or testing. Remove strip from sample when confirmation window is completely filled with blood sample. Wait for meter to start the 5-second countdown.
So we now have the blood glucose reading of 82, and we can enter that into REDCap.
Record the participants' results in REDCap. Follow the alerts and actions required if any value falls out of the normal range. If glucose is greater than or equal to 126, notify Dr. Whiteley and Dr. Heyman during the checkpoint visit to talk with the individual prior to their departure from the session. The participant will be rescheduled for a second fasting blood draw. If glucose is less than or equal to 59, check symptoms, provide orange juice, recheck symptoms, and walk the participant to University Health Services if they are still symptomatic. Reschedule the participant. If participant's blood glucose is greater than or equal to 126 for second blood draw, contact Dr. Whiteley, who will counsel the participant and instruct them to receive HCP clearance. Healthcare provider clearance direction may be further clarified by the study coordinator. For the hemoglobin A1C test, you will need a blood collector, a shaker, a cartridge, and the monitor. This test is performed immediately following the glucose test. Gently squeeze the finger again after the blood glucose test, holding it downward until a third large drop of blood forms. If the blood smears or runs, wipe away and allow for a new drop of blood to form. Do not milk the finger. If no new drop forms, prep a new site on a different finger for a new stick. Gently touch blood collector to the tip of the blood drop, such that capillary action fills the entire collection tube. Insert blood collection tube into open end of shaker and push firmly to insert into the base. Check for full insertion of blood collector into the shaker. There should be no gap between the blood collector and the shaker. Invert for 5 seconds, then stand shaker on table with the blood collector side up. Open the red pouch containing the cartridge and insert into site at bottom of the monitor. Wait will appear on screen. Then SMPL will appear on the screen, which means sample blood is ready to be inserted. Remove the base from the shaker and quickly press the shaker tip into the cartridge until the word run appears. Place used shaker immediately into the sharps container. Lie monitor flat on the table. A 5-minute countdown will begin immediately. Following the 5-minute countdown, the result will alternate with Q, C, O, K. If something else appears in the window, check the manufacturer's instruction for the error code.
We now have the HbA1c reading of 5.3, and we can enter that into REDCap.
Record the participants' results in REDCap. Follow the alerts and actions required if any value exceeds the limit. If HbA1c is greater than or equal to 6.5%, notify Dr. Whiteley during checkpoint visit to talk with the individual prior to their departure from the session. Healthcare provider clearance is required for the participant to continue with the remainder of the checkpoint visit.